Hi, everyone. It's my honor and pleasure to introduce our closing speaker for tonight, Dr. Connie Casillas. Dr. Casillas is a family physician for Kaiser Permanente, Los Angeles Medical Center, Pasadena. She is also on the faculty for Kaiser Permanente's Bernard J. Tyson School of Medicine and Kaiser's Los Angeles Family Practice Residency. She has been working on healthcare workforce development and health equity programs for the past 7 years within Kaiser, as well as in her roles on various nonprofit boards, but of course, including Alliance and Mentorship as its CEO for the last 3 years. Without further ado, I would like to welcome our closing speaker, Dr. Consuelo Casillas.
Buenas noches a todos. Good evening, everyone. Can you hear me okay? Okay, thank you to all the student leaders, MiMentor, who are hosting this virtual event. I'd like to just say a few words about hope as we close up here. Esperanza, my second daughter, Catarina's middle name. It has a lot of meaning for me, and I believe for this organization. So 4 years ago, I accepted the Alma Award from my colleagues at MiMentor, and I promised that I would do more in the future to give back to MiMentor. I had no idea at that time what the future held for MiMentor. 4 years later, a global pandemic that has ravaged our communities, racial and social unrest, personal and collective losses to our familias, our communities, and probably nearly 100 MiMentor students who have matriculated to medical school and beyond in that time frame. 2 former MiMentor student leaders, now AIM board members. Thank you, Drs. Franco and Del Rosario. Because of your hard work, we've had a 100% increase in our MiMentor membership. Because of your commitment and your persistence, we've had a 1,000% increase in our budget with 2 new multi-year state grants. Because of your love for each other and for this organization, we have persisted. We have learned a lot, we have grown, and we are stronger. A few days ago, I was at my partnership's New Hire University, where there was 190 new physician hires training to staff our organization across Southern California. In a demographic where there's nearly, and in many counties, over 50%, over half Latin population. Not more than 5% of those 190 new hires were Latina. That is not enough. We can do better, we will do better, and with your leadership, MiMentor will lead the way. So my grandmother immigrated from Guadalajara with her young mother and father to find a better life. Her father worked as a groundskeeper at a local Catholic school in Victoria, Texas. Of the 9 children that she bore, one of those children went to college. That was my mother. And although she didn't finish college, she went back later after having me and my siblings, and she simultaneously pursued her undergraduate degree with myself while I pursued mine. We are resilient. We come from resilient roots, and we face adversity with courage and strength. Earlier this week, an older patient of mine, 70 plus, who was recently diagnosed with an incurable neurodegenerative disorder, celebrated having been reunited with her biological mother's family after she was separated from her mother against her will at 1 year of life. With a smile on her face, we celebrated life and her blessings. She joked about her age and how it wouldn't really help her incurable neurodegenerative disease. We laughed and we celebrated life. My other patient who lost her husband recently to COVID and also went through 2 surgeries separately for 2 separate cancers she was diagnosed with within less than 2 months, is persisting with a smile, with strength, without flinching, without looking back. Because she's resilient, like you all. We come from resilient roots. So I'd like to close by telling you 5% is not enough. And although we've we've made some gains, especially in the last decade. Maybe no coincidence because of MiMentor. In medical schools, we're closer to 12%. But we will continue to fight effectively and forcefully for equity in the healthcare workforce. For our patients, our communities, if that's what they need, that's what they deserve. So with tenacity and with humility for each other and for our collective community, we will continue to fight forcefully for health equity in the workforce. And I look forward to working with all of you in the future. I especially look forward to this organization being led by all of you, the future healthcare leaders, my future doctoras. And I thank you all for all of your hard work and your persistence and your resilience. We have hope. Thank you all.